received a missing person call in the area 300 Robinson. It's going to be a white male in his 70s.
If you've been working the streets for any length of time, you've probably come in contact with an Alzheimer's patient, an elderly man or woman who is lost and confused, who may not know who they are or where they live. This training video will help you identify Alzheimer's patients and deal with them appropriately and safely. Focusing on the specific issue of Alzheimer's and similar diseases is another example of our commitment to community policing.
911 emergency.
My husband has wandered off.
Okay, what's the address you're calling from, please?
Please, he's been gone for 2 hours. And he doesn't know where he is. I know he doesn't know where he is, and I can't find him. I need help.
This woman is frantic because her husband has Alzheimer's disease and is missing.
Alzheimer's disease is a progressive neurological disorder. It starts with memory loss, recent memory loss. It progresses until the patient is basically unable to provide care for themselves.
And when an Alzheimer's patient wanders away, every moment counts.
They have no idea where they're going or what they're doing. They can walk right out in front of a car. They can walk down the street with no clothes on. It's just something of the memory loss is so great that they really do not know what they are doing. They are not connected with reality.
You'll be fine, you'll be fine. We're going to get somebody out there. We're going to look for him for you, okay?
He's wearing a thin red shirt, blue pants. He's been missing all day.
Concerned neighbors may offer leads.
Have Alzheimer's. RP's concerned about the subject. 615 case.
Or you may spot the missing Alzheimer's patient walking down the street during routine patrol.
Does that look like that might be him?
Yeah, it looks like him right there.
Okay.
He's about 7 years old, blue pants.
We would approach him slowly. Someone like this is probably confused, might not know where he is, might not even in fact know his name. So we want to keep him calm. Basically, time is on our side and on his side. We're in no hurry, so we're not going to rush the situation. If we rush it, then we're going to startle him and maybe create something that we don't need to create. Hello. How are you? Are you okay? My name's Pam. This is Sean. So we will approach him slowly, establish good eye contact with him, get him focused on us, and try to find out what it is where it is he's trying to go, where he's supposed to be. See if he can remember anything about himself.
But above all, be concerned about your own safety.
We can't make any assumptions about anybody based on their appearance. So always for an officer, safety comes first. Okay, Bob, what I want to do is help you get to your family. So I want to invite you to sit in the back of the car. But before I do that, I need to make sure that you don't have anything on you that's going to hurt you or that's going to hurt myself or the other officer, all right? Okay? So I'm just going to check and see if you have anything on you that's going to hurt either one of us. So we'll assess the situation. We'll approach slowly and make sure that that person's not going to present any immediate threat to us. Once we've established that they're not presenting an immediate threat, then we'll start the contact on a casual note, seeing if we can establish some type of rapport with the individual. I appreciate your trust. There you go. You're doing just fine. Just fine. Okay, why don't you go ahead and have a seat. Just make yourself comfortable. Watch your head going in. There you go. A little different there, isn't it?
Alzheimer's patients lose much of their body awareness, so Bob needs extra help getting into the patrol car. You may even have to help him bend his legs and scoot them in before closing the door.
Okay, I'll get that shut for you. Make sure you have everything in. Watch your hand.
Sometimes your encounter with an Alzheimer's patient won't be quite so easy. They can be combative or find themselves in a dangerous situation.
How you doing today? Hi, my name's Sean with the police department. Just relax. Okay, what we want to do is get you out of traffic.
Well, the first thing we're concerned about, obviously, is their safety, because now they're in traffic, and also the safety of people in the cars. So we want to get them out of the street as soon as possible so we don't cause any kind of traffic accident.
You go ahead, take my hand. Take my hand. Well, let's go ahead on over to the curb. Okay, don't be nervous. Don't be nervous. We just want to get you out of the street. Okay, because too many cars are in here. Just go ahead and take my hand. Take my hand. Okay, come on. That's right. Come on over here to the curb. I know. How you feeling today? Okay, well, let's just go ahead on and get out of the street first. I know too many cars right now. Let's stand right here.
Well, they may be afraid of who I am approaching them. I'm going to try to approach them as, you know, as cautiously as possible and try not to make them feel uncomfortable as I get them out of the street. But that is my primary function at that time.
So why don't you come with me and we're going to find out where you need to go. Okay, just come on down here. There you go.
Another delicate encounter with an Alzheimer's patient, urinating in public, is not uncommon.
How you doing today? Hi, don't be nervous. My name is Sean with the San Diego Police Department.
And Alzheimer's patients may wander into stores and shoplift.
Sir, will you do us a favor? We understand that you've taken a couple of things off of the shelf, all right? And we want to make sure that we get that back to the 7-Eleven people. Okay, hang on just a moment, all right? Do you mind if I look? Yeah, he's got a couple of things in his pocket.
Again, the key here is patience. When dealing with an Alzheimer's patient, remember, your safety comes first. Always approach from the front, never from behind. Calmly introduce yourself. Establish eye contact. Speak in a friendly tone of voice. Use simple phrases, and don't rush, and continuously reassure the Alzheimer's patient as you try to find out who he is and where he belongs. The Alzheimer's patient most likely won't be able to tell you who he is or where he lives, so delicately search for identification, and always check to see if he has an ID bracelet.
Just take a look at your bracelet here. He's got one of those safe return bracelets on him.
Does that have a number on it?
We can, yeah, it sure does. It sure does. It's got, that's okay, you're okay. You're quite all right, you're doing just fine. It sure does. It's one of the safe return bracelets here, we can give them a call.
Bob received this special ID bracelet when he enrolled in the National Safe Return Program founded by the Alzheimer's Association. In San Diego, Alzheimer's patients sign up at police storefronts and precincts, with the retired Senior Volunteer Patrol coordinating the program.
And you wish to be enrolled in the program?
Yes, we do.
It's a way of identifying a person at risk. And if a police officer comes upon a bracelet that says this person's name or a coded number, we can access this 800 number at any time. We then would know an awful lot of personal history about the person at risk. Immediately we get the identification of the person who had the bracelet. We get the caregivers. We'll get maybe a medical history on the person. And we'll even get other family members or friends who would be willing to assist. If we couldn't find a primary caregiver, we at least would have a loved one we could turn the person over to.
You can access this 800 number from any telephone 24 hours a day. The number is 1-800-572-1122. If a patient isn't wearing a safe return bracelet, you still have a high-tech option. Through the National Crime Information Center, NCIC, call the 800 number we just gave you. Describe the person you found. Safe Return has access to NCIC and will send information, including a photo by fax, of Alzheimer's patients enrolled in Safe Return who match the description you gave them. You can retrieve your fax at the nearest precinct or storefront.
Oh, does it look familiar?
He is. Oh, where did you?
He seems to be just fine.
Find him. Oh,
He seems to be just fine.
oh, sweetheart, I've looked for you. I know. It's all right. It's all right, sweetheart. Next time we'll walk together, okay?
Project Safe Return, cutting police time and offering Alzheimer's patients and their families extra promise of a safe return.
A missing person call in the area 300 Robinson. It's going to be a white male in his 70s named Bob Adams. He's wearing a thin red shirt, blue pants. He's been missing all day. The subject does have Alzheimer's. RP's concerned about the subject. 615 King?
615 King, 10-4 from 3700.